to our three witnesses for the second session. And I wonder if I can just ask you to introduce yourselves, just say who you are and where you're from, rather than making a statement at this stage. You get plenty of chance to say things as you're answering questions. So if I can ask Anna Round first.
Hello, I'm Anna Round. I'm a Senior Research Fellow at IPPR North.
Great. Jessica?
Hi, I'm Jessica Studdert. I'm Deputy Director at NLGN, New Local Government Network.
Thank you, Jessica. And Vicky?
Good afternoon, I'm Vicky Selleck, Nesta's Executive Director of Programme and the lead on our work on government innovation.
Great, thank you. Now, because we've done this alphabetically, Baroness Wild, who's at the bottom of the list, as it were, beginning with W, she gets to ask the first question in this round.
Thank you, Chair. It's very rare to go first, so I'm very privileged. I just need to declare my interest before I start. I am a non-executive board member at Ofsted. In the health space, I am employed as a freelance consultant on an ad hoc basis with the Chadlington Consultancy, and one of the clients I'm at time to time involved with is Penn Medicine, which is an academic medical centre in Philadelphia. So welcome to all the panellists. If I could just start by asking, in your view, have public services worked well together or not, as the case may be? And depending on your answer, would you like to draw our attention to any particular case studies? And I don't mind who wants to go first. Anna, if we're going in alphabetical first names.
Yeah. So I should say that one of the observations that we've had in gathering together evidence on which to draw in this session is that actually at the moment a lot of public services are just busy doing the day job, and so sharing information about what they're doing is maybe not the highest priority. I think we've talked to quite a few organisations where there's a lot of obviously very good work that's making a big difference, if you like, at the grassroots level. And I think there's a real job to be done as this goes in, as we go into the second phase, as we go into recovery, of drawing together some of that learning from grassroots approaches and from very local and very place-based approaches, so that is, we keep that learning, we share that learning, we make sure that it's resourced going forward. I think our finding from a lot of, and I'm going to talk about local government examples primarily here, is that there's an enormous amount of that really good practice locally, that a lot of that is to do with working together across services, but also drawing in partnerships with the community and voluntary sector, both with formal community and voluntary sector organisations, but also with communities more broadly, using links into those communities through existing local government services and through less formal relationships, and also with businesses. So one example in the northeast of England is where the local authority has used some of the capacity that's been created, because obviously services where people are in contact with service users are not working as normal, and that's been used to coordinate volunteers across the city with need, and that's built on local authorities' networks, on existing partners, on existing community and voluntary services. And I think we've seen that's not just happened in the North East, it's happened in quite a lot of areas. So that sort of building on established networks and established ways of collaboration we've seen quite a lot of examples of that. And I think that's happened quite broadly.
Thank you, Anna. Jessica.
Thank you.
Thanks. I think I'd say it's been a slightly mixed picture in terms of working well together. I think I'd say when we're thinking about the successes, I'll start with, local systems have been working quite well together. And I think when you see partners in a place, whether it's local government, working with health partners, partners in the emergency services, the police, fire, ambulance, working with the voluntary sector, you've often seen quite a lot of organisations coming together to meet need. From the local government perspective, I think the early days and weeks of lockdown involved a very rapid rapid process of identifying need in the area, identifying who was shielded, who was vulnerable, i.e. not shielded but had vulnerabilities, and the wider public, what they needed and how to get that help to them. And I think that really has been a hallmark of the local government response, and understanding that actually as an individual organisation the challenge is too great. So I think we have seen a lot of collaboration between organisations where it's been about getting need responded to as quickly as possible, and there's lots of examples of that. So for example in Birmingham, the NHS and the local government work together really well on an early help scheme. So there's a really accessible website where families can just literally go on the website, apply for a grant instantly, understand what support's available, and you've seen that replicated in a lot of areas. In Greater Manchester, very well-established partnership across health, the local government and other partners. And so I think where you've seen established partnerships already in particular, that's kicked into gear, and it's been the response has been very strong. I think one of the hallmarks of the response nationally has been the overwhelming community response, where themselves have been organising themselves into mutual aid groups, popping up in neighbourhoods, but using WhatsApp, using just adverts in the local newsagent, identify who needs help and who can provide help where there are volunteers. So it's one of the best examples, I think, of public services themselves working has been when they've been able to tap into that community energy and existing kind of local infrastructure of neighbourhoods, neighbours supporting neighbours, and support that. So tap in, therefore, the food distribution to those existing networks. Tap in where there's other volunteers that want to do some free volunteering to match make in that sense. So I think you've seen some really positive things coming from local areas, communities themselves, and public services together. One of the areas I would highlight at the beginning where it's not been quite as positive has been the central disconnect, quite a centrally managed process that has bypassed the existing resources and assets that you do get in local areas, particularly local government. And we have seen examples of data not being shared well. So for example, local authorities didn't have information about shielded groups very early on from the NHS, even though they were responsible for delivering them food and essential supplies. And I think we've seen the contact tracing systems not going local as a first port of call, but being set up in a different way that bypasses existing public health capacity. So I think we've seen a mixed picture of very strong and interesting innovations coming from local areas, and a lot to build on for the future when we're thinking about public service reform, but slightly revealing of the disconnect between central government and how it interfaces with local areas.
Thank you. Vicky, do you want to say anything on this?
Mainly to echo exactly what Jessica said. Lots of good examples of services working together at a very local level with immediate response needs, whether it's shopping, befriending, accessing volunteers, checking in on elderly neighbours, getting people to hospital appointments, etc. But also on a macro level, just actually schools and nurseries really being very thoughtful about the fact they need to provide capacity for other frontline services workers, essentially, and seeing their role in a wider public service ecosystem. And yet the great downsides have actually been from central to local. I point to contact tracing as well, but also the fact that so many of the announcements, sadly, in the last month or so, have been made without first informing the local providers, and so head teachers unaware they were going to be asked to open on a certain date, etc. Would be a good, public profile example of some of the challenges we've had of a centralised system which has many local operating networks, and the flow of information and the way that has been integrated or just means collaboration hasn't been a hallmark.
Okay, thank you. And now I'm going to ask Lord Young, who really is at the end of the alphabet.
Thank you, Hilary. We've heard some really encouraging examples of good working relationships during the pandemic. To what extent has that been dependent on good relationships between the people concerned, strong personal commitments at the top of the organizations, rather than the particular structures? And to what extent have the existing structures got in the way of those working relationships working even better than they have at the moment?
I don't mind answering first on that front. We've been working with a group of 20 local authorities over the last year or two, people who we think have been establishing new operating models, new ways of giving away power and responsibility from the top down. And I think you're right, Lord Young, that they're often characterised by senior leaders who want to instill a different DNA within their organisation. So this isn't just about councils, local authorities who want to say, let's put digital at the heart and let's make sure we have the infrastructure to be able to operate remotely or do remove bureaucratic systems, for example. It's actually been leaders who've said, I trust my frontline social workers to make quick decisions in crisis moments, and I'm going to give them more autonomy to go beyond the bounds of what they're allowed to do normally, or their sort of safeguarding checklists. So a kind of very small example, but of alcohol workers working with people who are incredibly alcohol dependent, have been alcoholics for a long, long time. And as the lockdown was announced, just able to make quick decisions about who would actually have safe access to alcohol, albeit that is bad in the long term. It was incredibly important in the short term, so that we didn't have people street drinking, trying to undo social distancing rules to access alcohol quickly and in a crisis, but rather could have controlled access to alcohol to be able to see them through a particular period. And it's that sort of idea that actually your frontline staff are the experts in what they're doing and can make risk-assessed decisions on a case-by-case basis. And so I think we've really seen the best and most efficient, most effective models where people have got this DNA instilled in the council that they not only want to devolve power to their frontline workers, but they also want to work very differently with the other actors in each place. So with the private sector, with charities, social enterprise, etc.
Very interesting. Jessica.
Yeah, I think it's a really interesting question. I think probably the speed and scale of the response required has meant that certainly for local government, which I'm the sector closest to, normal structures have almost been suspended. There's been an enormous clarity of purpose and mission, i.e. identify who has need and meet that need. So actually, in reality, what that's meant is a lot of people have changed their job descriptions overnight. Their normal job role that they were doing isn't needed anymore, and they've had to be going and standing up a food hub from scratch, for example. You've seen a lot of frontline autonomy, and you've seen leaders who potentially, the way I describe it is maybe are leading on a tight on values, tight on missions, loose on delivery method structure, which is basically meaning people need to kind of use their own initiative far more. Local government, I think you could say that the normal rules of how local government operates have been suspended. If you say that the more traditional role of local government pre the crisis would largely be about allocating finite resource and judging thresholds of need and making an assessment about how to allocate finite resource to infinite need. Actually, overnight that's disappeared, and it's all about how you get people's needs met. No thresholds, there's no eligibility requirements, there's no definitions of people, and so there's been an enormous freeing up of local government as a workforce to work in a much more collaborative way with partners in the voluntary sector and community groups, and also to have much more human conversations with people about what they need and how we can help them get it. So I think there's some really interesting questions there about the role and power of culture and leadership with or without existing structures. And I think the operating environment for local government as well has become a bit more permissive for innovative ideas and a creative problem-solving approach, whereas in normal times pre-COVID, the risks of innovation and the risks of change may be overwhelming in comparison to the risks of the status quo. In the risky environment of a pandemic, the risk-reward profile has sort of shifted. So there has been a much more permissive environment for iterative ideas, try something, scale it up if it works, stop it if it doesn't. And so I think there are a lot of ways of working we can learn lessons from to how to kind of keep the spirit and the culture as we move on to think about public service reform in the round in the future.
Thank you, Jessica. Anna, did you want to say anything on this?
Yes, I'd really echo a lot of what Jessica's said, and I think we've spoken to people in some local authorities where actually the fact that they'd moved very much towards that much more partnership and asset-based way of working with communities has really enabled an agile and very effective response to COVID locally. So where people have set up partnerships with communities where the local authority is much more of an equal partner, bringing what it does well and what it can do well to the table alongside communities who are invited to do the same. And where I think also the point about having a particular kind of conversation with local authorities, which is devolved and asset-based and community-led, has been really important. That sense of working towards solving problems and consulting, but also I think being very clear that what the local authority can do is things like provide support, provide contacts, provide a point for sharing intelligence, provide sounding boards, so that there are specific things that local government is very good at within those relationships. I'd also, I think that leadership is important in this, but I think that organisational culture and permission to work in innovative ways is probably as important and more important in the long term in sustaining that way of working. I think one of the other things really important, it comes back to what Vicky said earlier, is about trust and about enabling trust and having the confidence to trust. And obviously that's different in the short term when you have very clear, very straightforward, very easily shared goals, and how we read that out to the longer term goals and roles for local government when we're out of the immediate crisis will be really interesting.
Thank you. Thank you, George, for that question. Can I ask Lord Hogan-Howe now to ask the next question?
Yes, thank you. I think we've heard clearly that you've identified there are some good examples of fractures between central government leadership and local government leadership. And you've also identified good practice where locally good leadership within an organisation has enabled people and empowered them. But what can we take from the crisis to put into the future locally, where there is a disjointedness between service provision, when there is no crisis and there is no emergency to drive it? What have we learned that we can replicate in the future in structures and processes?
Who wants to go first?
You want to start, but
okay.
Yeah, I think actually the increasingly empowering local areas is a really important lesson. I think that the local response has been very strong. Quite a lot of that has been under the national radar. So one thing that we can learn is to have a really good and open conversation between local government, between tiers of local government, and between local and central government about what local government has achieved and what local areas need to maintain that learning and to keep doing things well where they've been able to do that, and also the places where the local central relationship has not made that easy and has not supported a good place-based response. So I think there's the kinds of open conversation that we've seen local areas have with partners. We probably need to learn about that for the local central relationship going forward.
Yeah. Jessica?
Yeah, I think certainly one of the factors about the response has been the extent to which communities themselves have been mobilised to help in their very near neighbourhood, and the sense that a lot of us being housebound for lockdown have a strong sense of our local community. And I think that those kind of less tangible senses might be carried forward into how we think about public services, how we think about resourcing local authorities and local public services. On the one hand, there is the community capacity that exists. How can that be used much more? How can people have much more control and say over the services they use and influence how they are designed so that they're more accessible in many different ways? And I think I would need to strongly say the situation for local government is incredibly precarious when we're thinking about funding, and the finance for local government has not been at all secure throughout this process. Local government was told early on by the Secretary of State that it could spend whatever it takes to get needs met in communities, but there's since had a significant rowing back of that early commitment, and 3.2 billion pounds has been allocated to local government, which is very welcome, but actually the estimates range from about 10 billion to 13 billion in terms of overall costs of outlay of the service response, but also in terms of lost income for local authorities. So I think there's been the disjointedness will really be embedded much more if we don't put local public services on a much more sustainable footing. And I'd contrast the experience of local government with the experience of the NHS, which has had its costs met in full. Trusts have had their deficits written off unquestioningly, and that just puts the public service at a much more secure place to be able to plan for the future. And I think from the perspective of local government, cuts to their funding and lack of certainty over the future of their funding makes it much harder for them to plan, makes it much harder for them to have a 4-year sort of investment plan in the area, makes it much harder to collaborate with other services and think about how you do things differently and innovate. So I think the disjointedness is a really important question, and one of the areas that we've all got to be thinking about is how you can kind of bottle the spirit that's been happening in the sense of mission and clarity of purpose and bring that forward.
Thank you, Jessica. Vicky, did you have anything to add?
Yes, I'd say actually one of the biggest lessons we can take away from all of this is that public sector workers are innovators. We've sort of long championed this at Nesta, as you might expect, given we're the UK's Innovation Foundation. But I think quite often the public sector has this reputation for being slow to act and to adopt new ideas. And this crisis has proved the exact opposite. Very, very quickly in Leeds, they'd organised how to cook and distribute 4,000 meals a day. Very, very quickly in Staffordshire, they'd rewritten everybody's job descriptions and had a one council approach where people were reassigned to new tasks, providing emergency response, etc. So actually, we must now champion public servants as being just as innovative, just as agile, just as cutting edge as some of their colleagues in the private sector in the way that they have responded to this crisis. And I think if we could take some of that spirit forward and some of that championing, it would actually help us to recruit good talent into the service, but also really be a kind of hallmark of trust then of the sort of things that central government might ask local government to do, or the sort of things that we, the public, might ask our public servant sector leaders to do for us. I think it's also really taught us that responses are about place and they're not about institutions. And just as some of the examples we've already heard this afternoon have really highlighted that actually this is about local services working together very closely with the communities that they serve, rather than this being about a single institution coming up with an answer and rolling it out. And where that has happened, it's actually proved often to fail and to slightly fall on deaf ears, but slightly be a mismatch with whatever the demand is. And so really trying to bottle this sense that you need to work for thriving local communities and that each actor has a part to play: citizen, community, charity, social enterprise, public sector, and the wider state, I think is really important. And the third thing, I guess, is that digital is now the new normal. And so not only have we seen digital services that were planned to be rolled out over 2 years sort of adopted over 2 weeks, but actually I think we'll see changes now in how education is delivered. So parents and students expected not just to do a little bit of homework online, but actually being taught online much more frequently, parents able to engage, whether it's sort of basic phonics things for young children, through to much more complicated learning and lessons and testing online through ed tech platforms. I think that's going to be a completely normal part of the teaching profession now. And the same for how we access GP appointments. So that's a huge surge in how many people are happy to have a phone appointment, which is slowly being followed by a curve of how many people are happy to have a virtual, a video conferencing appointment. But I think that will become much more normal now. And what follows from that is lots of efficiency savings and lots of things where we'll have much more data to be able to work out what's going on. But some things for the public sector to deal with that are complicated. Things like, does this mean we now need a workforce that actually works from 7 a.m. to midnight rather than from 9 till 5, because people want to have online consultations at different time, etc. And what would that mean, and how could we use that as a real benefit in creating more flexible jobs, things which allow people to do childcare or other caring responsibilities, rather than a real drain on what is already a tight set of resources for both schools, GP surgeries, and for local government.
Great, thanks, Vicky. I'm now going to move to Lord Hunt, and you just started to ask what I think he's going to ask.
Hi, thank you. I mean, we've just had a really encouraging response about the innovation that we've been seeing from the front line. And also, I think Jessica said, local governments basically suspended the normal rules of engagement. And by doing so, can show just how innovative it can be. I wanted to ask about data sharing, because often we hear from public bodies that they'd like to integrate services more, but they have a big problem about data sharing. One doesn't know if that is reality or whether it's an excuse, but have we seen examples where different agencies actually have been able to share data, which we could build upon for the future?
Yes, Vicky?
Yeah, over the last 2 or 3 years at Nesta, we've been working with a number of different places on offices of data analytics. So essentially a central hub in a single place, which takes data from police forces, from healthcare trusts, and from local government. And together, those agencies sign agreements to be able to use one another's data and interpret it through this central hub. And I have to say that my sort of expectation going into it was that you would need a lot of staff, lots of different data analysts, people working on it. Actually, they are very kind of lean, mean, efficient machines. They need a relatively small amount of resource, because the power of AI means that you can interpret data for the patterns you want to find, but also you can be finding patterns you weren't expecting. The computer will tell you things that you were not expecting to find. And so it means actually you can do that with a relatively modest investment in the technology. And so I think we've seen some brilliant data sharing examples, but I have to say, I haven't heard very many examples of people doing that really well and quickly during this crisis. So it tends to be those people who'd already established and set themselves up well. London probably is the best example, where they have the London Office for Technology, where different boroughs invest in a central hub. And they've set up lots of different premises, both for how you share access to different IT resources and different data sets, but also how you develop apps or quick interpretations of things, different digital interfaces, but in an open source way, so that other people can replicate them, other councils, other boroughs can take the same code and be able to put it into place very quickly. And I think someone in the previous round of evidence mentioned that one of the challenges of this crisis has been lots of public sector commissioning, which has been outsourced to companies at great expense and without some of that sort of open source written in from the beginning. So they had to act fast, and they sort of took the terms that were on the table, rather than saying everything that's built must be built in a way that means it can be copied by other people, other different public service agencies around the country quickly. And that's a nervousness for me, that some of the things we know have worked over the last few years haven't been adopted in this crisis.
Very interesting. Okay, can I get you to be fairly quick, because we're starting to run out of time? Jessica.
Yeah, very quickly. I'd look to Greater Manchester for some examples of health and local government data cooperation, collaboration. They have a governance sharing agreement. So I think there'd be some good examples there across public services. Hackney Council is one in London. There are a number in London, as Vicky said, and there's good collaboration across London. Hackney are using a unique property reference number to identify people, and what they're doing at the moment is identifying people who they think might be vulnerable to future effects of the pandemic. So for example, people in private rented sector, in social housing, people who are self-employed, so people who might become economically vulnerable, as well as people who might be in health terms vulnerable to future waves of the epidemic. So there is some interesting data work going on. And one of the key points about data is it's often seen as being kind of harvested for its own self. Actually, from a perspective of local government, the real win would be to understand people's needs in the round, so that rather than one person having lots of different services intersecting housing, employment, health separately, is so that all these services have a whole understanding of the person. So actually, from the perspective of the individual, you would potentially want your data shared, because it would stop you having repeated conversations with different people who don't understand all the aspects of your life. So I think there's a merit to having a very human conversation about what all these public services need your data for, because it actually might be to make your life a bit easier.
Yeah, we've had that argument for a long time. Anna, have you got anything you want to add?
Yes, two things briefly. One is I absolutely echo that. I think a wider point about this is actually how everybody's digital literacy has changed, and how their crisis has exposed needs for a different kind of learning and conversation about understanding of digital, and that might include the understanding of where data sits within public service, and actually how data sharing is part of a public service. It's something else that we've heard about as one of the areas where central to local links have not necessarily been as good as they could have been. So that while data sharing at the local level there's been some really good examples, actually central government sharing data with local government, with local agencies has not necessarily been great. There's often not one single channel, so that opportunity to bring data together has really been missed.
Okay, thank you. Can I move now to Lord Bishard?
Great examples of how some local areas have responded very positively to the pandemic. Clearly that varies. Some have been better than others. You've gone on to say, give us some reasons why some have been better than others. You talked about leadership, you talked about culture, you talked about trust, and you talked about a sense of place. I just want to encourage you to think whether there are other issues which have made the difference. In other words, have some local areas started from a better place, better position? And what can we learn from that when we start looking at the future of public services, or as I would say, services for public good? Jessica?
Right. Okay, Jessica, do you want to start?
So, I mean, I think you're right to say there are a number of factors. There's different spatial scales that different local authorities work over. So some of the challenges for a large county, for example, that covers a massive geographic area would be very different from an inner London borough that for example, that looks at a smaller footprint, but actually has a very high density population. So there are definitely kind of geographical and demographic factors. I'd say the primary factor that may influence a quicker response and a more rapid response would be existing relationships. So local authorities who already have good dialogue, good forums, good working relationships with their voluntary sector, for example, were able to, very quick off the mark, understand that they were their route into communities and a trusted kind of resource for neighbourhoods. So I think, and I think similarly, where there are already existing devolved relationships, not just Greater Manchester, but other areas of the country that have a good working relationship as a kind of health and care and wider system, probably we're in a much better place to go from a standing start into some of this.
Thank you. Either of the others got anything to add to this? Anna?
Yes, I would agree. Where we've seen great examples, those have often built on networks and relationships, partnerships and ways of working that are already in place. I think that there is also a fairly stark issue that local authorities have come from a long period of extremely constrained funding, and that's meant that, you know, we've seen great creativity, huge commitment, but actually that has been constrained by you know, financial austerity over a long period, and the knock-on effects of that in terms of the staffing, the resources, the assets that local authorities had to work with. So, you know, as well as the issues of funding within the COVID-19 crisis itself, there's a long period which will have made things harder for local authorities to use some of the great resources that they've deployed.
Okay.
And one further example to add to what's already been given, I guess, is just places where the mentality and the narrative and the communications, particularly from council leaders, has been about we're in it together and we're making choices together. And I think that feeds with what Anna's been saying. It's actually particularly places who've narrated a period of austerity as talking to their residents about what would you like us to prioritise, what shall we do together, and what will your role be versus what will our role be. And that's sort of famously advocated for by Donna Hall's work originally, but also by more recently places like York City Council, who've just had very honest conversations with their residents about how will we each take a role in building a thriving place and looking after the most vulnerable, and making this a sort of better situation. That's meant they could lean on the relationship not only with other actors in the sector, but also directly with their residents as they've responded.
Thank you.
Thank you. Can we move now to Lord Bourne?
Thank you very much indeed, and thanks to our witnesses. One very interesting feature which we picked up as you've been giving the evidence is the very effective collaboration that we've seen with local authorities, working with the voluntary sector, working indeed with the private sector. I think one key issue is how we're going to be able to ensure that that continues as the crisis abates and as we come out of the crisis. I'd be just interested in hearing your feelings on that. Perhaps Vicky first.
Yeah, I think a little bit, as we've said so far, those people who've already established that trusting relationship are going to find it much easier to stick with this. Those people who have had to build that very quickly over the last 10 weeks, already actually we're seeing some examples. So we've been out interviewing staff from 20 different local authorities just over the last 2 or 3 weeks as part of our studies, and already we're seeing this sort of pendulum swing back on a few things. The pendulum swing back on how much frontline workers are trusted to take decisions themselves, swing back on whether or not you will give money, autonomy, decision-making power to voluntary sector organisations, etc. And so I think some of this, again, it's sort of reinforcing a point we've made multiple times in this hearing, that it's about those people who've embraced a sense of local government, particularly being a placemaker and holding place tightly, but not caring whether or not they are the delivery agent for everything, and actually realising they're responsible for outcomes, but they do not need to be the doer on all of it, and they can trust partners in different fields to do the work in the way that they see fit.
Yes, Jessica.
Yeah, I'd absolutely echo what Vicky said, and just keep in mind the distinction between means and ends. I think often we can talk about delivery means and processes and forms of delivery entirely detached from what outcomes you want. And I think if we're clear on the galvanizing sense of mission, people themselves being part of understanding their place in the future that everybody shares in a place, the delivery mechanisms come in alongside that and underneath that, and actually voluntary organisations, community groups, people themselves coming together to form groups may be a more powerful way of delivering things in the future, people taking control of things much more directly themselves, communities themselves being in the driving seat might be one of the avenues to be exploring in terms of future public service delivery. Because it's a really galvanizing force, and because it can get people excited. And I think one of the things we've seen in this crisis is that there really is the community capacity. It exists. It needs to be mobilized and harnessed in the right way, and can be incredibly rewarding for places.
Yeah, did you have anything to add, Anna?
I think also as part of that, keeping up that relationship of trust between communities and local government, the same can be said for the relationship between local and central government, where local government has done that really great work on the ground. I think there's something really important. We've talked about sharing quantitative data. One of the things that has come through is hugely important in local areas, and again, this is something that was going well already and that's been a huge driving force in effective responses to COVID, is sharing, if you like, the sort of human sociological intelligence about places, about communities, about how things work very locally, and that really is about enabling and listening in conversations. So I think that having the space for both kinds of data sharing has been important. To add a sort of slightly less optimistic note, I think some of those community resources and assets will have additional pressures on them as we move into the recovery phase, as some of the economic impacts continue to be there. So again, the need for resource for different kinds of sustenance, so that those can continue to be a really positive force in the long term. That'll be something else that needs consideration.
Thank you.
Great, thanks very much. Now, Lord Davis, we've sort of covered your question already, but I wondered if there was anything else that you wanted to follow up on.
I think a lot of it was covered in Lord Hunt's previous question, particularly by Vicky's answer. So I think we can move on. Yeah.
Thank you very much indeed. Lord Filkin.
Thank you, Hilary. Throughout the discussion, you've covered quite a lot of points on this question. So you might want to focus on things that you think are additional. The question is essentially about what are the lessons for future models of service delivery from the crisis. Who wants to kick off? Go on, Jessica.
Yeah.
So I would try and boil it down to 3 lessons. Firstly, a shift from a traditional approach to public services, which directly commissions or directly delivers, and essentially seeks to do to people, to give them a service. A shift from that towards one which fundamentally seeks to work with people. And so that would be a much more preventative approach, much more based on people's innate assets and capabilities, and working with people in a different way. So you shift from services doing to people to working with them. I think we've understood much more some of what we would always consider less tangible facets of people's lives, but that are really important to them, like social networks, loneliness, things that services, you can't have a loneliness service. You need to understand how people's lives are and activate networks and mobilize networks and support their place within that. So that would be shifting from the local government role from much more of a direct provider and deliverer of services to seeing itself as an enabler, as a platform to patch together resources and assets in different places and meet need in different ways, using digital capability for that. But just as importantly, I think for local government is knowing when to step back and when to just let things happen because they're happening already in communities, and to play a much more supportive role. And that could be echoed throughout the system. Central government could step back when local government has the capability to proceed. My second was covered actually by a question before, which is that culture can be much more powerful than structures. And I think we tend to think of public service reform as being a big bang structural reform that we kind of create on paper, we implement, and then it stays fixed in a point of time. Actually, reform is public service is more iterative. We should have a constant kind of learning process, but we should be thinking about less tangible things that really do matter, like culture, like creating a can-do attitude, the importance of relationships, above and beyond existing structures. I think we can get very bogged down in structures. And we've talked a bit about digital. I think the one thing, my third point would be around digital. The one thing I'd say is we've done a lot during this crisis of getting stuff that we used to do offline has been moved online. That's been great. Barriers have been broken. People have become much more digitally literate overnight. The next stage from that is really for those processes themselves to change, to take advantage of the capabilities that digital really creates. So that's not just sort of single dialogue, bilateral relationships. It's much more about digital as a platform and as an enabling platform. The digital democracy, and Vicky will know much more than I know Nesta are doing a lot of work on this, but the idea that democratic processes are just a kind of once every 4 or 5 years election really has an ability to really shift in terms of people being much more involved in decision making on a much more ongoing basis, using open sourcing ideas, crowdsourcing ideas, using people voting and participatory budgeting. So I think that we are in a really good positive space digital, and actually now we need to kind of move on and see how digital itself can transform the system back.
Thank you. Yes, Anna.
I'd absolutely echo the point about asset and place-based working as being two really important areas of learning. I think there is potentially some maybe less positive learning about the places where COVID has shown up some of the inequalities and in some cases the gaps, particularly those associated with austerity, and how some previous changes have brought real challenges for public services. I think the digital point is extremely interesting. One of the things that is slightly problematic about this is we've had a huge move to digital. We do still have a digital divide in society, and at the moment one of the problems is that people who are on the wrong side of the digital divide can end up with very little voice. So we really have a task of learning about what the experience has been like if you've ended up on the wrong side of that digital divide, how we can shift people across it effectively, safely, sustainably, and how those voices can continue to be part of the mix. I think something else, and again, this is about learning from the crisis, but also working out how we move on in the future, is around the human element. So something that has been characteristic of a lot of the really effective responses is people going above and beyond. And what they've very often done when they go above and beyond is give of that human side of the things that reduce isolation, that improve empathy, that build trust. That's hugely important. So looking at how to nurture and sustain and recognize that and build systems that encourage that human element is really important. I think also recognizing that actually human beings are a resource that need to be nurtured and replenished. There's some really good examples, again, quite local and quite grassroots, of public services which have done good things in looking after their staff, their mental health, their response to immediately very distressing circumstances, very heavy workloads. And I think that will be really important learning.
Thank you. Can I now move on to the next question? Sorry, Vicky, we're just running a bit late here. Baroness Pinnock.
Thank you, and I will declare my interest again, which is as a councillor in Kirklees Council in West Yorkshire, where I know Nesta have been involved in consulting with them. And the question I have is about thinking as we move out of this phase of the pandemic, what step-down services do you think will need to be established as we end the sort of crisis element of what we're doing now?
I think we're probably quite a long way away from ending the crisis element, and that's the sad truth, is whilst everything feels different suddenly as various bits of lockdown are eased, actually we know that schools are unlikely to return properly before Christmas. The same will be true about how people access a whole load of other public services, and particularly we are nervous about the number of people who have not been to a healthcare appointment in the last 3 months. And so I think a particular focus for us is on those families who are most likely to be in crisis. So children who are living in absolute poverty, or families where we think there is domestic violence at work. And the second is in these healthcare appointments, you know, the numbers of people who we're expecting have undiagnosed cancer, for example, or the people who didn't attend with a mild set of symptoms and actually need to go through a diagnosis process. And I think that's where the first part of the response needs to go. And the second is in really getting children back to school and back learning. And at Nesta, lots of our work has been on how technology can really empower and enable students, how it can really reduce inequalities, particularly how it can promote young girls from ethnic minority backgrounds into fantastic careers in the future. And the nervousness is that even the 3 months out of school already has set many children back a year in terms of their learning. Now, you may well be able to catch that up if you're age 4. It's going to be much harder to catch up if you're 16. And so I think we need some real attention, not only on getting all children back into learning, whether that's a mix of part-time in the classroom and online at home, but also how do we really focus our attention on catching up those young people who sadly won't have been doing so much home learning over the last 3 months and may well not have access to more over the 6 months that come. So the step down services really ought to be focused on them.
Anna.
I think the point about vulnerability is really important. So COVID has both created new kinds of vulnerability and created particular problems to people across a really diverse range of vulnerabilities. So I think getting good evidence about what sorts of services people in different kinds of vulnerability need. And that will be a task partly of sharing that data and that human intelligence and of working in very place and asset-based ways. So I think that's important. Absolutely echo the point that education is really important. I think there's also a question about how we move within public services from a crisis mode with those very clear goals and outcomes, and also with the a shifted funding environment of this will be paid for, actually to what is the long-term environment and what are the constraints on funding in the longer term, and there's learning about being quite open about what those funding constraints will make difficult.
Yeah, Jessica.
I'd absolutely echo the point about funding. I think from a local government perspective, some services have been quite quiet during lockdown. For example, children's services, a lot of referrals into children's services come via schools. So they're being shut means that they're quieter than usual. Evictions have been suspended, so housing services have been less in demand. So I think local authorities are expecting spikes in demand as lockdown eases, and potentially new cases that emerge being at more critical crisis point than before. So I think I would think of it less in terms of new step down services than reinforcing existing services. And that's why the dangerous funding situation that local authorities are being put in, with lack of clarity over their costs being met currently, and then looking at a future economic downturn that will affect council tax take, will affect business rates take, and will affect their income over the longer term, is incredibly damaging to their capacity. They have children's services, they have housing support. The local safety net exists. It just needs to be invested in, and we need to understand the consequences of not investing in it.
Thank you. Can I come to Baroness Keithley?
Yes, Anna spoke very eloquently about inequalities just now. So perhaps I'll ask for brief answers from Jessica and Vicky, as we're very close to our time, about lessons that we can learn about reducing inequalities in the new approaches that we're hoping public services will adopt.
Well, I'd say, first of all, one success we can definitely point to would be the national approach to homelessness, where we've seen overnight people taken off the street and put into safe and secure housing, and commitments from the Minister that will continue for a long time. Actually, that is not just an emergency crisis response. It's looking at the person as a complex, with a complex narrative behind it, and needing a multi-agency response. And I think there's really something to learn from that actually we can move very quickly when we want to. We can sort of untangle the politics as well as the process and move very, very quickly if we are convinced that there is a group that need our help, essentially. And so I think there's really something to be learnt there about how agencies work together, and particularly how they view citizens and the complexity of their needs, not just the single need they're presenting to the single public service that they're accessing at the time. On the sort of more downside, I'm really nervous about schooling and about how inequalities have increased. So just for example, the Sutton Trust put something out last week, I think, saying that school teachers in private schools were getting 87% of the work they'd assigned back from their school children. In the top performing state schools, they're getting about 20 or 25% of the work that they've assigned sent back. In underperforming or less well-performing state schools, they're getting 8% back. And so not only are private school students actually getting more teaching, we know that how effective that teaching is being, and the online teaching and the things that parents are doing meant to be at home, it's just being received in such a different way. And so I'm nervous that we have not been more strategic about that from the beginning. And I think the lesson has to be that was a sort of obvious inequality that we could probably all see coming. And so what would we need to do as a response to act differently next time, to say we recognise that state school students that have low access to IT, low levels of parental engagement at the beginning, and live in families that are likely to have workers in precarious work are unlikely to engage in the online material sent by school. So how will we redouble our efforts to reach them in the first few weeks, rather than sort of realising 2 or 3 months in that inequality is only widening and now we're kind of grappling to catch up? I think it's a real lesson for the future.
Thank you. Jessica?
I'd just say, I think one of the stark features of the inequalities that have been exposed by COVID is that they vary significantly geographically and demographically. Then inequality isn't spread equally across the country, and by definition it varies from place to place. Inner city inequality is a different experience to rural, being poor in a rural area, for example. Your experience as a BAME individual can be palpably different, and there again, your experience as a woman could be very different from being a man. It's incredibly important that, although we think of public services, the principle of universalism, for example, with the NHS being free at the point of need and accessible to everybody, those inequalities have persisted despite a system that is accessible for all. So I think we need to understand on a much more granular level the impact of health inequalities and how vulnerable that makes populations to something like an epidemic, but how that we can in the future understand public services as being much more agile and place-based, understanding the specifics of the communities it works with, and being able to respond differently in different areas, and that variation actually being a way of really countering that inequality rather than embedding it deeper, which I think is just a different way of understanding how we might approach public services to cope with variation.
Thank you very much.
Thank you. Where are we with time? We've got a very quick opportunity for Baroness Tyler to ask a supplementary, and then I think this will be the last question.
Just very briefly, when we finally emerge from this pandemic, whenever that is, I just wondered what sort of shared approaches you thought that public services should put in place to support service users. I'm particularly interested in the point Anna raised about people who've been left behind by all the move to digital. So I'm particularly interested in Anna's response to that.
I think one of the things that we really need to, I mean, one thing there is the provision of equipment in education. I think that's been a really huge divide in this. We just, if education does become more digital, we need to look at how basic digital services, but also digital literacy, digital enablement, things like online security, understanding how to stay safe in various different ways online. That will all become important. Access to good quality broadband, so there's the technical side of digital enablement. I think there's there's also a hugely important question, and that this would be particularly the case in education, of looking at what digital can do usefully in education and also what it can't do. So the role of digital in doing the human things that are really, really important in education, in making those accessible, in curating those, and also in stepping back when the role of digital is not the first thing, or when a non-digital context is the ideal, is important. So I would say part of that digital one of the digital skills is to understand where digital is useful and enabling and where it is not. I think, again, looking at those, the inequalities that have emerged in the pandemic, types of vulnerability in the home have changed, particularly for children, but more broadly. So loneliness being a huge issue. And again, looking at how we move forward from that. And again, digital being a part of that, digital enablement and learning being a part of that. I think another of the inequalities that has happened through COVID, and again, this has a digital aspect, but it goes beyond digital, is actually people who've moved from precarity into crisis. So, around income and unemployment, changes in family circumstances, changing in needs for caring responsibilities, changes in job conditions. So I think all of those are things that we will need to look at very seriously as we move on.
Thank you.
Thank you. I'm really sorry that we don't have time to ask the last question about families, but if you've got anything to say about that, just drop us a note. And I'm sorry I can't bring Jessica and Vicky in. We just have run out of time, which is inevitable in these sessions. So I'm really appreciative of what you've done and of the enthusiasm and commitment that you've all brought, all 6 witnesses. As I said at the beginning, this is our first evidence session, and we're all suffering from the clunkiness of technology doing it rather than being able to see one another face to face. I hope we don't lose that there are some good aspects of seeing each other directly. But anyway, can I just say thank you very much indeed. And I am bringing this session to a close, and I am going to ask that if members of the committee have got the time, they will join me on another platform in order to just do a quick roundup and prepare for next week. But for everybody from today, thank you very much indeed. I'm really appreciative. Thank you.
Thank you.